Makers, it's clear that behavioral health will be a top priority this coming session. The North Dakota Department of Human Services is doing its part by changing the state Medicaid plan to give more access to those who need addiction treatment. For years, the department has covered addiction services, but as Medical Services Director Maggie Anderson explains, the clause was so confusing and buried into overall Medicaid coverage that licensed practitioners and other addiction counselors weren't applying. Anderson says by adding a separate section in the coverage legislation directed towards enrolling counselors, it'll be clear who can be covered and how much.
We would sit in hearings and in stakeholder meetings, and people would talk about North Dakota Medicaid doesn't enroll licensed addiction counselors, and yet we knew we did. And so we recognized that it was confusing and we needed to kind of unbundle that to make it easier for practitioners to understand so they would enroll, which ultimately leads to services for our providers.
The amendments won't cost the department up front, but it would ultimately cost the state more as people start using treatment services. Another notable change is that licensed treatment programs will no longer need to be under the direction of a physician. The director of the Behavioral Health Division says this will increase access to help people in rural communities because now smaller providers will be eligible through these changes instead of having to be a part of a larger healthcare facility.
In the old system, if an individual maybe didn't have the finances or the medical coverage to seek treatment services, they would go to a regional human service center. Well, sometimes there's a private provider in your home community that could do that service, but because there was no way for them to be reimbursed, the individual may have to, travel 60 miles or 100 miles to get to the nearest human service center.
The changes were effective in the start of November, but since it's ultimately an agreement between the state and federal government, the department will need final approval on the amendments from the Centers for Medicare and Medicaid Services in Maryland. They expect approval to happen early next year.
Justin